What I'm about to show you may change the way you look at every blood pressure pill sitting in your medicine cabinet. Because if you are taking amlodipine, losartan, or lisinopril, one symptom you have been dismissing as age, stress, poor sleep, dehydration, or just a bad day may actually be your body trying to warn you that your medication is affecting you in a way no one fully explained. And that is what worries me. People do not usually get hurt by blood pressure medication only because it was prescribed incorrectly. They get hurt when they do not understand what the medication is doing inside their body. They get hurt when they miss the clues. They get hurt when swelling, coughing, dizziness, weakness, strange heartbeats, or confusing blood pressure readings are ignored for too long. Before we begin, please subscribe to this channel so you never miss clear health guidance made to protect seniors and their families. I'm Dr. Robert, and if you've been told to take amlodipine, losartan, or lisinopril for high blood pressure, there are 11 things you need to understand right now. Not because your doctor is hiding them from you, but because appointments are short, explanations are rushed, and many patients leave with a bottle in their hand, but only half the information they need. By the end of this video, you will understand which side effects are common, which ones can be dangerous, which ones sound harmless but should still be reported, and why the most important truth about blood pressure medication is not just the number on your monitor. It is whether you can safely stay on the right medication long term. Let me start with Gloria. Gloria was 72, organized, careful, and disciplined. She took her medication exactly as prescribed. Her blood pressure improved beautifully. On paper, everything looked perfect. But 3 months later, her shoes felt tight. Her ankles were puffy every evening. Her socks left deep marks. Her legs felt heavy by bedtime. She thought she was gaining weight. Her daughter thought maybe it was her heart. Gloria was scared because nobody had explained that the medication helping her blood pressure could also cause a side effect that looks like something else. And that brings us to number 11. Number 11 is this: amlodipine, losartan, and lisinopril are not the same pill with different names. They all lower blood pressure, yes, but they do not work the same way. Amlodipine is a calcium channel blocker. Losartan is an ARB. Lisinopril is an ACE inhibitor. Different class, different pathway, different side effect pattern. Amlodipine can commonly cause swelling in the ankles and lower legs. Lisinopril is known for a dry, nagging cough in some people. Losartan is often used when someone cannot tolerate that cough, but it still needs respect because of potassium, kidney function, and dehydration concerns. Same goal, different clues. If you cough on lisinopril and think every blood pressure pill will make you cough, you may become afraid of treatment. If you swell on amlodipine and assume your heart is failing, you may panic unnecessarily. If you feel fine on losartan and assume nothing needs monitoring, you may miss a quiet problem building in the background. The name on the bottle matters. The class matters. The pattern matters. Once you understand the pattern, your body stops feeling random. Number 10 is the one Gloria was living through. Amlodipine can cause ankle and leg swelling, and this is one of the most misunderstood side effects in blood pressure medicine. People think it means they ate too much salt. They think their kidneys are weak. They think they are gaining weight. Or they think, I'm older now. Maybe this is normal. But with amlodipine, swelling can happen because of how the medication relaxes blood vessels. Fluid can collect around the ankles and feet, especially later in the day. That is why people often say, I'm fine in the morning, but by evening my socks leave marks. Arthur was 76. A few weeks after starting amlodipine, his ankles looked larger every afternoon. He ignored it at first. Then he started skipping doses when he wanted to go out because he was embarrassed by how his legs looked. That is how a manageable side effect can turn into uncontrolled blood pressure. The swelling may not mean the medication is wrong forever. It does not automatically mean something terrible is happening, but it absolutely means the conversation needs to happen, especially if the swelling is new, getting worse, painful, only on one side, or comes with shortness of breath, chest discomfort, sudden weight gain, or unusual weakness. Do not panic. Do not stop the pill on your own, but do not silently live with it either. Tell your doctor when it started, whether both legs are involved, whether it improves overnight, and whether it began after starting or increasing amlodipine. Number 9 is something people brush off for far too long. Lisinopril can cause a dry, persistent, nagging cough, and this cough does not always begin right away. Sometimes it starts within days, sometimes within weeks, sometimes after months. That delay is why so many people miss the connection. They blame allergies, they blame dust, they blame acid reflux, they blame dry air. They blame an old cold, but the cough is usually dry, scratchy, irritating, stubborn, and often worse at night. Helen was 69. 4 months after starting lisinopril, she developed a tickle in her throat that would not go away. Then came the nighttime coughing. Her sleep got worse, her energy dropped, and she thought maybe she was just getting older. She bought lozenges, changed detergents, and replaced the air filter. Nothing helped. When someone finally asked when the cough began compared with the medication, everything clicked. This matters because many patients suffer with this cough for months. Some eventually stop the medication on their own without telling anyone, which is exactly what we do not want. But listen carefully. A dry cough on lisinopril is usually not the same as a dangerous emergency. It can be frustrating, and it should be discussed with your doctor. But the symptom that should make you move fast is swelling of the lips, tongue, face, or throat, especially if breathing or swallowing becomes difficult. That is not a wait-and-see situation. That is emergency care. So if you hear cough, do not panic. Call your doctor and discuss it. But if you hear tongue, throat, lips, face, swelling, or trouble breathing, that is the moment to move fast. Number 8 is one of the most dangerous traps because it hides in plain sight at the grocery store. If you take Losartan or Lisinopril, potassium matters. And many people think, I don't take potassium pills, so I'm fine. Not necessarily. Potassium can show up in salt substitutes, heart-healthy seasoning blends, electrolyte drinks, meal replacement drinks, wellness powders, and supplements. Losartan and Lisinopril can both raise potassium in some people. High potassium can be dangerous because it affects the electrical rhythm of your heart. It may show up as weakness, muscle cramps, tingling, fatigue, palpitations, or sometimes almost no symptoms at all. Robert was 74 and trying hard to be healthy. He reduced sodium and switched to a salt substitute because he thought he was protecting his heart. But many salt substitutes replace sodium with potassium. So Robert was taking Losartan, which can affect potassium, and seasoning every meal with extra potassium. He began feeling weak and noticed skipped beats in his chest. When his labs were checked, his potassium was too high. Robert was not careless. He was trying to do the right thing. Nobody had connected the dots for him. So if you take Losartan or Lisinopril, ask your doctor or pharmacist, is a potassium salt substitute safe with my medication and kidney function? That question matters even more if you have kidney disease, diabetes, heart failure, take a diuretic, use supplements, or drink electrolyte products. Do not assume something is safe just because the label says heart healthy. Number 7 is about kidney numbers. This one scares people because lab reports can look frightening when nobody explains them. Losartan and Lisinopril are not just blood pressure medications for many people. In the right person, they may also be used because they can help protect the kidneys or heart over time. But when these medications are started or when the dose is increased, your doctor may check blood work. They may look at creatinine. They may look at eGFR. They may look at potassium. And sometimes the kidney numbers shift. To a patient reading a lab report alone at night, that can feel like proof the medicine is damaging the kidneys. Sometimes a change can be a problem, but sometimes a small early shift is expected and needs monitoring. Not panic. Sharon was 71 with high blood pressure and early kidney disease. Her clinician started Lisinopril. A few weeks later, she saw a lab number change in her patient portal and almost stopped the medicine that night. But the key question was not just, did the number move? The key question was, how much did it move? What was the starting point? What is the trend? And what else is happening in the body? That is why lab follow-up matters. It is part of the treatment. So if you see a lab change, do not make a secret decision alone. Call, ask, clarify. Ask whether the change is expected, whether it needs rechecking, and whether potassium or kidney function needs closer monitoring. Number 6 is one of the most overlooked dangers in older adults. Dehydration changes everything. If you take Losartan or Lisinopril and then get vomiting, diarrhea, fever, poor appetite, heavy sweating, or you cannot drink enough fluids, the medication that helped yesterday may hit differently today. Your blood pressure can fall too low. Your kidneys can become stressed. You may feel dizzy, weak, faint, confused, or unsteady. The medication did not suddenly become evil. Your body's fluid balance changed. Frank was 78 and had a stomach virus. He could barely eat, had diarrhea, and was not drinking much. But he still took his usual Losartan because he was proud he never missed medication. That night, he stood up from the couch. The room spun, and he nearly collapsed. The problem was not that Losartan was a bad drug. The problem was that his body was depleted. He needed a sick day plan. Many seniors do not know what to do with blood pressure medication during vomiting, diarrhea, dehydration, or poor fluid intake. I am not telling every person to stop medication during illness. That depends on your health, kidneys, heart, medication list, and doctor's instructions. But I am telling you to ask before you need the answer. Ask your doctor. If I get vomiting, diarrhea, fever, dehydration, or cannot drink fluids, what should I do with my blood pressure medication? That question can prevent a lot of suffering. Number 5 is the hidden trap sitting in millions of medicine cabinets. Ibuprofen, naproxen, anti-inflammatory pain relievers, a few pills for the back, a few pills for the knee, a few pills after gardening. If you take Lisinopril or Losartan, especially if you also take a diuretic or water pill, regular use of certain anti-inflammatory pain medicines can create a serious kidney and blood pressure conversation. This shocks patients because every piece feels ordinary on its own. Blood pressure pill, pain reliever, maybe a water pill. Nothing sounds dangerous. But together, especially with dehydration, these combinations can affect kidney function and blood pressure control in some people. Carol was 73. She took Lisinopril for blood pressure, a water pill for swelling, and ibuprofen several times a week for arthritis. She never mentioned the ibuprofen because she did not think of it as medication. Then her labs worsened, and her blood pressure became more unpredictable. At first she said, nothing changed. Then someone asked specifically about over-the-counter pain relievers. That was the missing piece. Some of the biggest medication dangers do not come from rare side effects in tiny print. They come from common combinations nobody reviews carefully enough. If you take Losartan or Lisinopril, over-the-counter pain medicine is not a casual topic. It is a safety topic. Bring up every bottle at your medication review, including vitamins, supplements, sleep aids, cold medicines, pain relievers, and herbal products. Number 4 is the side effect people normalize until it becomes a fall. Dizziness, lightheadedness. That woozy moment when you stand up too fast, the weak feeling after the first few doses, the moment you grab the wall and say, I just got up too fast. Maybe you did. But in older adults, a few seconds of dizziness can become a fractured wrist, a head injury, or a broken hip. All 3 of these medications can be connected with dizziness in some people, especially when starting, increasing the dose, combining medications, or becoming dehydrated. Sometimes dizziness means your body is adjusting. Sometimes it means your blood pressure is dropping too low. Sometimes it means dehydration. Sometimes it means another medication is contributing. Joseph was 80 and lived alone. 2 days after his medication dose was increased, he stood up in the bathroom at night and felt the world tilt. He grabbed the sink just in time. He did not fall, but he came close. He had been told the medication might lower his pressure, but he had not been told what that could feel like in a real body, in a dark house in the middle of the night. That is the difference between prescribing a drug and preparing a patient. Mild dizziness may improve. Fainting is not something to ignore. Repeated dizziness is not something to silently endure. So rise slowly, sit on the edge of the bed before standing, use a light at night, and tell your doctor if dizziness continues, worsens, or almost causes a fall. Number 3 is where many intelligent people accidentally sabotage their treatment. They look at one blood pressure reading and treat it like the whole truth. One high number, and they think the medication failed. One low number, and they think the dose is too strong. One good number, and they think they are cured. That is not how blood pressure works. Blood pressure moves. It changes with sleep, pain, stress, talking, posture, meals, caffeine, anxiety, exercise, a full bladder, and fear of the reading itself. One number is not a verdict. It is a snapshot. What matters is pattern. Diane was 67 and checked her blood pressure whenever she felt worried. If she had a headache, she checked. If she read stressful news, she checked. If the number was high, she checked again, then again, then again. Soon she had a page full of numbers and a heart full of fear. She was certain her Lisinopril was not working. But when she slowed down, measured at the same times, rested first, kept her feet flat, supported her arm, and stopped checking repeatedly out of panic, the picture changed. The chaos was in the method, not the medicine. So measure properly. Sit quietly for 5 minutes. Keep both feet flat. Rest your back. Keep your arms supported at heart level. Use the cuff on bare skin. Do not talk during the reading. Write the numbers down. And do not check 20 times a day unless your doctor specifically told you to. That can turn a blood pressure monitor into an anxiety machine. Number 2 is about timing and missed doses. These medications work best when taken consistently. Same general time, same routine, same system. If you miss a dose, the answer is usually not to double up later unless your doctor or pharmacist specifically told you to do that. Many instructions say to take a missed dose when you remember, unless it is close to the next dose. If it is close, skip it and return to your normal schedule. But people double up all the time because they are scared. They are afraid their pressure will climb. They are afraid of a stroke. They are afraid one missed pill will undo everything. Martin was 75. If he forgot his lisinopril in the morning, he might take it at lunch. Then if he saw a high reading before bed, he convinced himself it was safer to take another tablet. The next day he felt washed out, weak, and unsteady. Martin was not reckless. He was afraid. But fear is not a dosing plan. Blood pressure medications are usually not rescue pills for random spikes. They are long-game medications. They work through steady use, not emotional reactions. If you do not know what to do when you miss a dose, ask. If you are not sure whether you can change timing, ask. If you are not sure what number should make you call your doctor, ask. Guessing feels small in the moment, but it can create big problems. And now we arrive at number 1. The most important thing many people are not told clearly enough. The best blood pressure medication is not simply the one that gives you the prettiest number for 3 weeks. It is the one you can stay on safely, consistently, and intelligently because it fits your body, symptoms, labs, other medications, and life. A medication can look successful on paper while failing in the real world. Your numbers may look perfect, but if the medication makes you cough all night, you may begin to dread it. Your blood pressure may improve, but if your ankles swell and nobody listens, you may start skipping doses. Amlodipine may work beautifully for one person and cause miserable swelling for another. Lisinopril may control pressure well for one person and ruin sleep with a dry cough for another. Losartan may be a good option for someone else, but it still demands respect for potassium, kidneys, and hydration. The point is not that these medications are bad. The point is that the right medication must fit the real person. Teresa was 70. Her blood pressure numbers looked excellent on lisinopril, but she was coughing every night, sleeping poorly, and beginning to dread the pill. She did not tell anyone because she assumed the answer would be, "You need it, so just live with it." That assumption is where patients disappear. First, they resent the medication, then they skip it, then they stop it quietly, then the blood pressure rises again, and everyone acts surprised. Teresa did not need a lecture. She needed a medication plan that fit her actual body. This is what I want you to remember. Side effects are not personal weakness. They are data. Swelling is data. Cough is data. Dizziness is data. Weakness after dehydration is data. A strange heartbeat is data. Muscle cramps are data. Lab changes are data. Your job is not to diagnose yourself. Your job is to notice the pattern and report it. Too many people think being a good patient means never complaining. That is not true. A good patient pays attention. A good patient speaks up early. A good patient does not stop medication secretly. A good patient does not wait until their throat is swelling, their kidneys are struggling, or their blood pressure is uncontrolled because they quietly stopped the medicine weeks ago. So here is the practical framework. If you take amlodipine, watch for ankle swelling, leg heaviness, flushing, headaches, dizziness, and swelling that gets worse by evening. If you take lisinopril, watch for a persistent dry cough, dizziness, and any swelling of the lips, tongue, face, or throat. If you take Losartan, watch for dizziness, weakness, dehydration during illness, and possible potassium signs like muscle weakness, cramping, tingling, or irregular heartbeat. With Losartan and lisinopril especially, blood tests may matter. With all three, consistency matters. And with every single one of them, a symptom you cannot explain is worth discussing. Not every side effect means catastrophe. Mild headache when starting a medication may improve. Mild dizziness may settle as your body adapts. A dry cough may be bothersome without being immediately dangerous. But not every side effect should be endured forever either. There's a difference between "this may improve" and "this is stealing your quality of life." There's a difference between "call your doctor" and "seek emergency care now." The answer is not panic, and it is not denial. The answer is understanding. So before you leave this video, do 3 things. First, look at your blood pressure medication bottle and know the exact name, not just my little white pill. Know whether it is amlodipine, losartan, lisinopril, or something else. Second, write down symptoms you have noticed: swelling, cough, dizziness, weakness, heavy legs, muscle cramps, tingling, palpitations, near falls, changes during illness, changes after supplements, changes after pain medicine. Third, bring that list to your doctor or pharmacist. Do not stop your medication because of this video. Do not double up because of one scary reading. Do not secretly skip doses because you dislike a side effect. Use this information to ask better questions. Ask what class of medication you are taking. Ask what side effects matter. Ask whether you need potassium or kidney blood tests. Ask whether your salt substitute is safe. Ask whether your pain reliever is safe. Ask what to do if you get sick and dehydrated. Ask what to do if you miss a dose. Ask what readings should make you call. That is how you protect yourself. Not by fearing medication, not by blindly trusting the bottle, but by understanding enough to have the right conversation before a small clue becomes a serious emergency. Amlodipine, Losartan, and Lisinopril can be very useful medications for many people. They can help control blood pressure. They can be part of protecting the heart, brain, kidneys, and blood vessels. But powerful medications deserve understanding. And over 65, understanding matters even more. So please hear this clearly. Do not stop your blood pressure medication because of this video. Do not make secret changes. Do not panic over every symptom. Instead, pay attention, track patterns, ask questions, report symptoms early, review your full medication list, and make sure your blood pressure plan still fits the person you are today. Because the goal is not just a pretty number on a monitor. The goal is staying safe, steady, independent, and protected for the long term. If this helped you, share it with someone taking blood pressure medication, because there is a very good chance they need this information too. And I will see you in the next video, where we keep breaking down the health truths seniors need to understand before they become emergencies no one saw coming.